Can you recall that iconic blue jar sitting on your grandmother's nightstand, the one she reached for whenever anyone in the house so much as sniffled? Before medicine cabinets became crowded with single-purpose remedies, our grandparents mastered the art of using simple, multi-purpose solutions that delivered real results. Today, we're uncovering 25 brilliant Vicks VapoRub tricks that earlier generations relied on. Techniques that will completely change how you think about this humble mentholated ointment. Start with respiratory relief for coughs and colds, something that might seem obvious until you learn the proper technique our grandparents perfected. They didn't just glob it on randomly and hope for results. The method began with warming the chest area using a heated cloth, preparing the skin to receive the ointment. Then they'd apply Vicks in a deliberate pattern, beginning at the center of the chest and spreading outward in circular motions. They used roughly a tablespoon's worth, massaging it in for at least 3 minutes until the skin felt warm and tingly. The critical part was covering not just the front of the chest, but also the upper back between the shoulder blades, creating what they described as a vapor jacket. After application, they'd pull on an old cotton t-shirt, ideally one that had been warming on a radiator or tumbling in the dryer. This technique proved so effective that many families bypassed doctor visits entirely during cold and flu season. The combination of menthol, camphor, and eucalyptus oil created a powerful decongestant effect lasting through the night. Our grandparents figured out that positioning just a small dab of Vicks at the base of each nostril, not inside the nose itself, but on that little groove between nostril and upper lip, produced an immediate clearing effect. They called this the mustache method, and it worked because vapors rose directly into nasal passages without irritating the delicate membranes inside the nose. Some would mix a small amount of Vicks with hot water in a bowl, drape a towel over their heads, and inhale the steam for 5 to 10 minutes. This technique gained particular popularity during the 1918 flu pandemic and continued through Depression years when medical visits were luxuries most couldn't afford. The secret was using just enough to feel the tingling sensation without overwhelming your senses. Many grandparents maintained a separate small tin of Vicks diluted slightly with petroleum jelly specifically for this gentler, frequent use purpose. Long before expensive sports creams hit the market, farmers and factory workers discovered Vicks worked exceptionally well for muscle pain. They'd warm the jar slightly by setting it in hot water, making the ointment easier to spread and helping it penetrate deeper. The application wasn't a quick rub and forget it situation. They'd invest 15 to 20 minutes working it thoroughly into sore muscles, especially after days of hard physical labor. The menthol created a cooling sensation that distracted from pain, while the camphor improved blood circulation to the affected area. Railroad workers throughout the 40s were known to carry small tins of Vicks specifically for their aching backs. The technique involved applying a generous layer, covering it with a warm, damp cloth, and leaving it there for at least 30 minutes. This created what they called a Vicks compress, remarkably effective for everything from strained shoulders to aching calves. Your grandmother likely knew that Vicks could eliminate a headache faster than aspirin. The technique required applying tiny amounts to 4 specific pressure points: both temples, the center of the forehead, and the base of the skull where it meets the neck. They'd use their index fingers to massage in small circles for approximately 2 minutes at each point. The cooling sensation combined with the aromatherapy effect of eucalyptus oil provided nearly instant relief. During the 50s, this remedy was so common that many women kept a small compact of Vicks in their purses specifically for headaches. The key was using very small amounts, about the size of a grain of rice at each pressure point. Too much would cause eyes to water and create discomfort. Some would also apply a thin line along the hairline from ear to ear, creating what they called a headache band that provided continuous relief for hours. Before antifungal medications became readily accessible, Vicks was the go-to treatment for athlete's foot. Our grandparents discovered that applying it twice daily, morning and night, after thoroughly drying the feet could clear up even stubborn cases within 2 weeks. they'd pay special attention to the areas between toes, using cotton swabs to ensure thorough application without cross-contamination. The thymol in Vicks possesses natural antifungal properties they didn't fully understand scientifically but recognized through results. Coal miners in the 30s who frequently dealt with fungal infections due to damp conditions would soak their feet in warm water with Epsom salts, dry thoroughly, then apply Vicks liberally before putting on clean cotton socks. This routine became so standard that mining companies actually provided Vicks as part of their first aid supplies. The treatment extended beyond just application. They'd also put Vicks inside their work boots to prevent reinfection. This remedy gained particular popularity among soldiers returning from World War II who developed fungal infections in tropical climates. They discovered that filing the affected nail slightly to roughen the surface, then applying Vicks directly to the nail and surrounding skin every night before bed could clear up fungus that had resisted other treatments. The process demanded patience, often 3 to 6 months of consistent application, but it worked. They'd use an old toothbrush to work the Vicks under the nail as much as possible, then cover with cotton socks. Some added a few drops of tea tree oil to enhance the antifungal effect, though pure Vicks was usually sufficient. The key was consistency and making sure to treat all affected nails, even those appearing healthy, to prevent spread. By the 60s, podiatrists were actually recommending this home remedy to patients who couldn't afford prescription medications. During the Great Depression, when specialized foot creams were unaffordable luxuries, families discovered that Vicks could transform even the driest, most cracked feet. The technique involved soaking feet in warm water for 10 minutes, gently removing dead skin with a pumice stone, then applying a thick layer of Vicks all over the feet, paying special attention to heels and any cracked areas. They'd then pull on thick wool socks and leave them on overnight. By morning, feet would be noticeably softer and cracks would begin healing. Farm wives who spent long days on their feet swore by this treatment, often doing it twice weekly during winter months when skin was driest. The petroleum jelly base provided deep moisturization, while the menthol and eucalyptus promoted healing. Some families would mix Vicks with a bit of baking soda to create an exfoliating paste for particularly rough areas. Before lip balm became commonplace, Vicks served as the winter lip savior. Our grandparents applied just the tiniest amount, literally what could fit on the tip of a pinky finger, to chapped lips before venturing out in cold weather. The trick was applying it at night primarily, as the menthol could cause tingling some found uncomfortable during daytime. They'd often mix a small amount of Vicks with honey to create a more palatable lip treatment children would tolerate. During the harsh winters of the 40s, this mixture was so common that many families kept a separate small jar specifically for lips, often adding a drop of vanilla extract to improve the taste. The camphor helped heal cracks, while the petroleum base provided a protective barrier against wind and cold. Long before DEET and other chemical repellents, our grandparents discovered that mosquitoes, flies, and other insects absolutely despised the smell of Vicks. They'd apply small amounts to pulse points, wrists, ankles, behind the ears, and the back of the neck before going outside during summer evenings. Farmers would even dab some on their horses and cattle to keep flies away. The eucalyptus and menthol created an invisible barrier insects found repulsive. During summer camping trips in the 50s, families would place open jars of Vicks around their campsite perimeter. Some would mix Vicks with citronella oil for enhanced protection. This method was so effective that military units stationed in tropical areas during World War II were issued Vicks as part of their mosquito prevention kit. The key was reapplying every few hours as the scent dissipated. Before antibiotic ointments were widely available, Vicks served as the household wound treatment. After cleaning a cut with soap and water, our grandparents would apply a thin layer of Vicks and cover with a clean bandage. The camphor acted as a mild antiseptic, while the petroleum jelly kept the wound moist, promoting faster healing. They were particularly careful to use clean fingers or a cotton swab for application to prevent infection. This remedy was so trusted that school nurses in the 40s and 50s often used Vicks for playground scrapes. The cooling sensation also provided pain relief, making it especially useful for children who were afraid of stinging antiseptics. Families would often keep a small emergency jar of Vicks used only for wounds to prevent contamination. Women in the 50s discovered that massaging Vicks into stretch marks from pregnancy could help fade them over time. The technique involved warming the Vicks between the palms, then massaging it into affected areas using circular motions for at least 5 minutes twice daily. The eucalyptus oil improved circulation to the area, while the petroleum jelly kept skin supple. They believed the camphor helped break down scar tissue, though this was more folk wisdom than scientific fact. Many women would mix Vicks with cocoa butter for enhanced results. This treatment required patience, often 3 to 4 months of consistent use, but many swore by its effectiveness. The ritual became so common, it was often passed down from mother to daughter as part of postpartum care wisdom. Our grandparents with arthritis discovered that Vicks provided better relief than many expensive liniments. They'd warm the affected joints with a hot water bottle or heating pad first, then massage Vicks in thoroughly, spending at least 10 minutes per joint. The technique involved starting with gentle circular motions, gradually increasing pressure as the joint warmed up. They'd then wrap the joint loosely with flannel or wool to retain heat. This treatment was particularly popular during the 60s, when arthritis medications had significant side effects. Many elderly people kept Vicks on their nightstand specifically for morning stiffness. The menthol provided immediate cooling relief, while the massage action improved circulation and flexibility. Some would add a pinch of cayenne pepper to their Vicks for extra warming effect, though this required careful application to avoid skin irritation. Perhaps one of the most ingenious discoveries was that rubbing Vicks on children's feet, then covering with socks, could stop nighttime coughing. This technique, popularized in the 40s, avoided the risk of getting ointment too close to young children's faces while still providing relief. Parents would massage about a teaspoon of Vicks into each foot, paying special attention to the arch and heel, then put on cotton socks. The theory was that vapors would rise and be inhaled throughout the night while the child slept. Pediatric nurses of that era often recommended this method for children under 2 who were too young for chest application. Many parents reported almost miraculous results, with coughing stopping within minutes. The ritual often became a comforting bedtime routine children actually looked forward to when sick. During the Great Depression and World War II rationing, when commercial deodorants were scarce or expensive, people discovered Vicks worked remarkably well. They'd apply just a tiny amount to clean, dry underarms, being careful not to use too much, which could cause skin irritation. The antibacterial properties of the eucalyptus and thymol actually prevented odor-causing bacteria from growing. Factory workers in the 40s particularly favored this method, as the strong menthol scent masked any body odor that did develop. The technique required applying it at least 30 minutes before dressing to allow the initial strong scent to dissipate somewhat. Some would mix a small amount of Vicks with cornstarch to create a drier application that wouldn't stain clothing. Nighttime leg cramps were treated with Vicks long before anyone understood the science behind why it worked. Our grandparents would keep a jar on the nightstand, and at the first sign of a cramp, they'd massage a generous amount into the affected muscle, working against the direction of the cramp. The menthol's cooling effect seemed to interrupt the pain signals, while the massage action helped relax the muscle. Athletes in the 50s discovered this remedy and would apply Vicks before and after competitions. The technique involved not just rubbing it on the surface, but really working it deep into the muscle tissue for at least 5 minutes. Some would follow up with gentle stretching while the Vicks was still active on the skin. This remedy was so effective that many doctors actually began recommending it to patients with chronic cramping conditions. Teenagers in the 60s discovered that dabbing a tiny amount of Vicks on pimples before bed could reduce their size and redness by morning. The key was using a cotton swab to apply just to the pimple itself, avoiding surrounding skin, which could become irritated. The camphor and eucalyptus had antibacterial properties while the menthol reduced inflammation. This had to be done carefully. Too much could cause skin peeling or burning sensation. Many would mix a tiny amount of Vicks with their regular face cream for a gentler application. This remedy was particularly popular because it worked overnight, and the evidence would be washed away in the morning, avoiding the embarrassment of visible acne treatments during the day. Families with cats discovered that immediately applying Vicks to fresh scratches could prevent scarring and speed healing. The antiseptic properties prevented infection while the petroleum base kept the wound moist. They'd clean the scratch first, apply a thin layer of Vicks, and reapply twice daily until healed. Farm families extended this to all manner of animal-related minor injuries. The bonus was that the strong scent often deterred pets from licking or bothering the wound. This became such standard practice that many veterinarians in rural areas actually recommended it for minor pet scratches on humans. During the 50s, housewives discovered that placing a small dab of Vicks in strategic locations could freshen entire rooms. They'd put tiny amounts under toilet rims, inside bathroom trash cans, or on air conditioning filters. The menthol vapors would circulate and neutralize odors rather than just masking them. Some would mix Vicks with baking soda to create potpourri-like sachets for closets and drawers. This was particularly popular in homes with smokers, as the eucalyptus seemed to cut through cigarette odor. The technique required using very small amounts. Too much would overwhelm the space with medicinal smell. Women discovered that massaging Vicks onto the lower abdomen and lower back could provide significant relief from menstrual cramps. The technique involved lying down with a hot water bottle first, then massaging about a tablespoon of Vicks in circular motions across the entire lower abdomen. The menthol provided a cooling distraction from pain while the massage action helped relax cramping muscles. Many women in the 40s and 50s preferred this to taking medication. They'd often follow the application with a warm compress to enhance the effect. This remedy was passed down through generations of women, often as part of a young woman's education about managing monthly discomfort. Before aloe vera became the go-to sunburn remedy, our grandparents used Vicks for minor sun exposure burns. They'd mix it with a bit of apple cider vinegar, creating a cooling treatment that took the sting out of sunburn while promoting healing. The application had to be gentle, patting rather than rubbing to avoid further skin irritation. This remedy was particularly popular at beach communities in the 50s. The menthol provided immediate cooling relief while the petroleum base prevented skin from drying and peeling as severely. However, they were careful to use this only for minor burns. Serious sunburns required medical attention. Factory workers and housewives who suffered from chronically dry elbows discovered that nightly Vicks application could transform rough skin. They'd scrub the elbows first with a mixture of sugar and oil, then apply Vicks liberally, sometimes covering with old socks with the toes cut off to keep the ointment in place overnight. This intensive treatment would soften even the roughest elbows within a week. The petroleum jelly base provided deep moisturization, while the active ingredients promoted skin cell renewal. This became such a standard beauty treatment that many women included it in their weekly beauty routines. During lice outbreaks at schools in the 40s and 50s, parents discovered that applying Vicks along the hairline, behind the ears, and at the nape of the neck could prevent lice from taking hold. The strong scent repelled lice while the petroleum base made it difficult for nits to attach to hair shafts. They'd apply it before school during known outbreaks, being careful to use small amounts to avoid greasy-looking hair. Some parents would mix Vicks with regular hair oil or pomade for easier application. While not a treatment for existing infestations, this preventive measure was remarkably effective and became standard practice in many communities. Our grandparents developed elaborate bedtime rituals with Vicks that went beyond simple chest rubs. They'd apply it to the chest, back, and feet, then place a small amount on a handkerchief tucked under the pillow. Some would even put a tiny dab on the upper lip. They'd use specially designated sick pajamas that could absorb the ointment without worry about staining. The room would be kept slightly warm to encourage vapor circulation. This multi-pronged approach created what they called a vapor tent effect that lasted all night. Many families had specific Vicks application patterns passed down through generations, each swearing their method was most effective. Before commercial shoe deodorizers existed, Vicks was the secret weapon against smelly shoes. Our grandparents would clean the shoes first, then apply a thin layer of Vicks inside, particularly in the toe area. They'd leave shoes in a warm place overnight to let the vapors penetrate the material. For particularly stubborn odors, they'd stuff the shoes with newspaper that had been lightly coated with Vicks. This method was especially popular among athletes and laborers whose shoes faced daily punishment. The antibacterial properties actually killed odor-causing bacteria rather than just masking the smell. Some would create sachets of cotton balls dabbed with Vicks to leave in shoes between wears. Thanks for joining us on this journey through time-tested wisdom. If you enjoyed discovering these remarkable remedies, hit that like button and share this with someone who'd appreciate it. And don't forget to subscribe for more forgotten household knowledge from the generations that came before us.